In 1948, the U.S. had just been through World War II.
There was a boy.
President Harry Truman urged Congress to adopt a civil rights program, and penicillin was introduced. At the same time, the LDS Church acquired the William Butch Memorial Hospital as part of the church's health system, and the name was changed to Logan LDS Hospital. Nursing looked much different in the mid-1900s. It was a time when nurses sterilized and reused catheters and sharpened needles.
When the doctors walked on the floor, you stood up for them and stayed standing until they left the floor.
Each shift would chart in a different color ink.
I loved just being there knowing that how sick they were, that what you were doing was going to help make them better.
Even from its early beginnings, it was widely understood that the level of care provided at this hospital was unheard of for a community of this size.
When the night has come.
1975. While the U.S. is trying to recover from the Vietnam War and Watergate, it is also the era of self-discovery. Microsoft is founded. The movie Jaws opens. Gas was 59 cents a gallon. And the LDS Church turned over its system of 15 hospitals, including the Logan LDS Hospital, to Intermountain Healthcare. The name changed to Logan Hospital.
Where I worked was in the latest addition to the old hospital. But the original, I believe the original wings were still there, and they leaked like a sieve. You talk to some of the older nurses and they'll tell you of stories with buckets in the hall as the rain leaked.
When I first started, we didn't have a functioning emergency room 24 hours a day.
If you needed emergency services, you rang a doorbell. And then it would be the house supervisor who would come down and see who was there.
The aging Logan Hospital was stretched beyond its capacity, and the decision was made to build a new modern facility. In 1978, the Project Tomorrow fundraising campaign to build a new hospital began. Community members, physicians, hospital staff, and volunteers contributed $2 million of the nearly $20 million facility, once again showing the community's commitment to have the best possible health care for the Valley and continuing a tradition of giving.
It isn't anything any one person puts on their shoulders and goes crusading off to do. It's a community effort. There's probably nothing more giving to the community than the local hospital.